On Thursday, we are having a cancer call-in. It's a chance for you to ask the doctors at University of Kansas Hospital all of your cancer questions. So this morning, we're joined by Dr. Richard Gilroy to talk about liver cancer. Now, this is a cancer that has some recent changes that everyone is discovering what leading to it. Who is most at risk for this?
So liver cancer is a disease that affects two populations. In children, it can affect people without cirrhosis, but for adults, we're talking about cirrhosis in all of them.
What's cirrhosis?
Cirrhosis is scarring of the liver.
Okay.
And the way to look at it is your liver, when you get cirrhosis, your liver has normal cells, but they're encased in a network, a bit like being in prison. That leads to back pressure, confusion, and these cells, when they try to grow again, it leads to cancers.
Is there a certain age people should be getting screened? Can you get screened for this?
So screening for liver cancer is an interesting point. What we tend to forget is that screening is applied to various populations. Anyone born between the years of 1945 and 1965 should be getting screened for hepatitis C with a one-time blood test. And that's a CDC recommendation from last year. Anyone with family members who have hepatitis, viral hepatitis, should be screened also for hepatitis B, in particular people who've come from Asia or people who've come from other areas where it is common.
Doctor, we've been hearing a lot about obesity really causing liver problems. Is that new? Is it recent? What's happening?
Okay, so the obesity problem is an interesting one, and it's actually one of the biggest problems facing the country. Estimated at $540 billion a year. And when we look at it, it's broken down to this. We had low obesity rates affecting something like 12% of Kansas City was obese in 1984.
Okay.
And we're looking at 32% now.
Wow.
Now, with that, the most common cause of liver disease is obesity, and soon to be the most common indication for liver transplant, if not the most common indication this year at the University of Kansas, is obesity.
What did it used to be? What did everybody think caused it?
Before, it was previously alcohol and
Sure.
hepatitis C, but hepatitis C now has a cure.
Sure.
And the new therapies are going to cure 100% of people, it would appear. And so, for me, job assurance seemed to be disappearing until obesity came along.
Oh, good grief. Okay, so if somebody is sitting at home, is there any kind of symptom or just general ailments related to this that they need to go see their doctor?
So the screening is a very important point. If you look at the population, they did a study and it was called NHANES. And NHANES said that when we looked at the population of those who are overweight, or the general US population, what we saw in the US, 30% have fatty liver. Of those, a small number have cirrhosis, but the cirrhosis is the big problem because they get liver cancers, and that's what we hear about today.
And we're not talking about extremely obese people, right? Just overweight?
If you're really obese, it happens more often.
Sure.
If you're less obese, it happens less often. But anyone who's overweight is at risk.
Dr. Gilroy answering good questions we all need to know. Again, Thursday is the cancer call-in. Doctors from University of Kansas Hospital from 4 to 6:30 p.m. So if you have questions, get those questions ready. Dr. Gilroy, thank you.
Thank you very much.